afternoon, everyone, and thank you so much for joining today's webinar, How Digital Can Revitalise Your Service Delivery. My name is Alice Roche. I'm the Head of Customer Service at Charity Digital. I hope that you're all keeping hydrated. I know for many of us in the UK, we're experiencing extreme heat. I'm down the English coast in Folkestone, so I've got a bit of a sea breeze. So just a gentle reminder to keep some water close by. And I'm just going to pass over to Susan, who's going to explain the next slide.
Thank you so much, Alice. So this is the Salesforce forward-looking statement. And this is just a quick reminder that Salesforce is a publicly traded company and that customers should make all buying decisions based on products and services that are currently available. Thank you, Alice.
No problem. So we just want to remind you just a few housekeeping rules just before we start the webinar. The webinar will be recorded. The recording, slides and supporting resources will be made available to you over the next coming days. So definitely keep an eye out for that in your inbox. Closed captions should also be available on the bottom right of the screen next to the record button if you need them. For any questions about today's discussion, please pop them in the Q&A box and we will answer as many as we can at the end of the session. The chat function is there for everything else. Tell us more about yourselves and the experiences you've had with service delivery and meeting supporter needs. I'm sure we've all done these webinars now, so feel free to chat with us in the chat function. And then once the webinar ends, you will be prompted for feedback. So we would love to hear your thoughts on how we can continue to inspire you. So yeah, definitely give us that. We would love to hear from you guys. So yeah, without further ado, I'm your webinar host. As I said, my name is Alice and I run the customer service at Charity Digital. And I'm now going to pass over to Brodie.
Hi, so my name's Brodie and I'm the IT applications manager for a charity called Mental Health Concern. So we are a mental health charity that spans across anything from community support all the way through to IAP services and 24-hour residential care. And I look after our Salesforce applications, which we use to run everything from a patient-facing, service user-facing way.
I'll go ahead and introduce myself, if I may. It's Susan Mahon here, and I'm on Team Salesforce. I'm delighted to be here today, so thank you for having us on the panel. I'm based in Ireland, so we definitely don't require cool drinks, unfortunately. It's on the cooler side. So I work in the marketing end of Salesforce, and I'm almost 6 years with the company now, and I've always worked with the nonprofit sector within Salesforce, which I have to say I really, really love. So I'll pass over to my colleague, Amy.
Thanks, Susan. Nice to meet everyone. I'm Amy Blacker. I've been working with Salesforce.org for 6 years and focusing mostly on the nonprofit industry. And currently I'm focused specifically on social services organizations. And I'm looking forward to showing you a use case example today.
Perfect, thank you all. And like we said, feel free to use the chat function to introduce yourselves because we can't see you. So I will now pass over to Susan to lay the foundations of the current state of service delivery in the charity sector.
Great, thanks a million, Alice. So I'm going to ground us in some reality this afternoon, and we're going to use the Salesforce State of Service for Nonprofits report, from which we have selected some stats that really do help to show the reality of what's going on in the service delivery side of the nonprofit sector. But before we reveal all of these numbers, we're going to get a little bit interactive here. And so I'd love if the audience members would post maybe their best estimates or their best guesses for what the results showed us in terms of each of these 5 questions that we asked. So if we think about the questions from left to right, 1 to 5, please go ahead and post in the chat some of your guesses. And before I reveal, I want to have a look and see how close to the mark you all are. So I'm going to open up my chat here and see all these great guesses coming in. Not seeing any yet. No guesses? Ah, Nikki, thank you. Thank you. You're quite close with some of them, Nikki. Anybody else hazard a guess? Well, look, I'm going to start to reveal, and you can always keep the guesses within your own head. Oh, Sarah, great. Oh, yeah, really, really great. Thank you. Oh, they're flooding in now. Fantastic. Yeah, some of you are really quite close. Other stats you might be slightly surprised with. So I'm going to get us to flick to the next slide, and we're going to do the first reveal. So 65% of European nonprofits say that they are delivering more services online and via digital channels than prior to the pandemic. So a considerable number, I would say. And, you know, as the world has become hybrid, really to a degree, being able to provide digital services is a must in order to be able to meet the needs of service users, requiring both online support, but also those who continue to require that physical or in-person support. So if we move in then to the next of our statistics, we have 75, next slide please, 75% of social service providers have found that managing case volumes has become way more challenging in recent years. And those numbers really do align with the fact that so many organizations and, you know, staff members are being pushed to the limit with the demand increasing year over year for their services. Organizations are experiencing staff shortages, staff burnout. New legislation is also having an effect on the ability to keep up with those ever increasing demands. Next slide, please. We've over half of European nonprofits finding that providing services, that they have found new ways to provide services since the pandemic. So that's really showing that adaptability of organizations, which is no surprise from this sector. We did see a shift to digital channels during the pandemic, but a lot of the infrastructure of many organizations really was never fit for this purpose. And for many, it is preventing them from scaling up to meet that ever increasing demand. So our next statistic, I think, is really a very interesting one. 55% of frontline service providers say that they need more training in order to do their jobs well. I think this really highlights an important area for attention, and we know that it's often a lack of resources and a lack of time that can prevent the delivery of training that is needed. And finally, if we get onto the service users themselves, we've 76% of people have an expectation of a consistency in terms of the interaction that they experience, even when they're dealing with different departments across an organization. That doesn't seem like an unreasonable expectation, right? But often those expectations can be challenging to meet as the demand continues to rise and as the resources continue to be limited and constrained in some instances. So really, in conclusion, there are as many ways to provide digital services as there are service users. And so it really depends on your users as to what the right approach is. But let's get some inspiration from Mental Health Concern, an organization that has done just this. So at Salesforce, we've seen more digitally mature nonprofits like this organization who have been more agile, who are able to move more quickly, innovate more quickly in order to meet that rising demand. But the shift to digital channels really does bring about a renewed need to focus on relationships, building relationships with service users, with supporters, with staff, with volunteers, so that, you know, impact can continue to be delivered at scale. So I'm really delighted to be joined by Brodie Lawton to discuss how Mental Health Concern are building a person-centric approach to care and the provision of services. And Brodie's also going to share with us his experiences in designing that approach and in implementing that approach. So welcome, Brodie.
Thanks for having me. Yeah, it'll be a pleasure to share that with you.
Thank you, Brodie. So I'm going to start off today by asking you maybe to take us back to a time before you had embarked on this journey of transformation. How were you delivering care and services? And then what sort of pain points were staff experiencing or were service users experiencing?
Yeah, so from a digital point of view, we used quite a lot of very niche industry specific case management systems mainly. I'm not going to name names, but I'm sure everyone here has had experience with these before. And also, look, fun fact, we also used an intranet-like system that actually our chief operating officer designed. So it really wasn't that fit for purpose. And that was leading to, poorer service user experience and poorer efficiency than we might have liked. Our systems function, their primary function, is to collect the mandatory data that the NHS and other commissioners want from us. And, it was doing that. Another function is, we need to capture therapist notes, and it was doing that as well. But, that's about all it was doing. And quite a lot of the features people have come to expect were absent. So yeah, this translated inevitably into unnecessary manual processes, which took our people away from their important work. And that in turn reduced our real-term capacity, because people were spending more time on administration than they were actually treating people with mental health needs. And for service users, first and foremost, that translates into longer waiting times because there's not as much clinical time available. There's not enough time to give them. And also, clunky onboarding, clunky administration services, and a real lack of interaction with our services outside of their scheduled appointments.
Yeah, interesting, Brodie. And I mean, if you think about that statistic around the expectations that service users have, you can see how all of these factors contribute towards poor experience, not just for service users, but for staff as well, right? So how did Mental Health Concern redesign the way that you provided services and that whole experience for users? Like, what did you decide to implement in order to fix some of those pain points?
Yeah, so we didn't start off looking at CRM. We started off with the problem. We identified that we had a problem with our digital strategy. We needed to improve our digital services. So the first thing we did is we utilized focus groups of our service users, service user experience questionnaires, or PEQs, quite a lot of people call them. And we also, used current processes and feedback from our clinicians to kind of draw out what the as is was, how are we doing things at the moment, and what is the ideal system for us. And we took that to market. So we looked at more off-the-shelf healthcare type systems. We looked at developing an application completely from scratch. So complete bedrock, build up from there. And we also looked at CRM. And as you might be able to imagine, we quite quickly decided that the former options weren't particularly, they weren't going to work, basically. The healthcare systems didn't have the functionality that we needed. And the custom development would have been too costly and time consuming for us to do. So CRM became our focus, and Salesforce entered our applications estate very soon after that. So the key areas while we did that exercise, the key areas that we found that we wanted to improve on for efficiency first were automating processes or parts of processes where that was possible, practical and clinically safe. So some of the things we did was automatically triggering communications using templates, but also, actual automated things. So via email, SMS to start off with, and things like integrated clinical questionnaires for service users to complete prior to their appointment. So we use things like GAD and PHQ questionnaires, which people on here might be familiar with, as well as our post-assessment and post-treatment PEQs as well. Another thing which was big was reducing data repetition. So we kind of came up with the thing that the same information should only ever be entered into the system once by one person and stored in one place. So the key thing for achieving that was ensuring an appropriate data model and using as much of Salesforce's off-the-shelf objects and fields as we possibly could, and also integrating as much as we could. So we're integrated with the NHS Spine to gather people's personal information and demographics, as well as other health and social care systems. Also data quality, and it's a big one. So we're addressing duplicate management, data stagnation, and eliminated conflicting data values. And we achieved that through proper validation, continuous cleansing of our data using external databases and services. And finally, for efficiency, we wanted to increase the quality and quantity of digestible and actionable information available to our clinicians. Oh, sorry, my slides have just, there we go. So basically that was achieved by designing a really easily digestible and user-friendly UI for our clinicians. And we used Salesforce features for that, such as reports and dashboards, which allowed our practitioners to drill down on the data in a way that suits them. And I think that's probably the most important one there, because quite often charities like us and other organizations, we've got the data, but we don't often do enough with it. And it's not often delivered to clinicians in a way that suits them and is appropriate. And in terms of service user experience, we improved that drastically as well. We expanded choice over how people can reach out for help. So previously you had the choice of phoning us or emailing us, and that was about it. Now we've got, and also walk-ins in some of our sites. Now we've got proper telephone system. We use a Salesforce CTI, using a product called Vonage as well. We've got properly integrated email, web form, chatbot, as well as that. And that's for people to self-refer and also for professionals to refer into us. And I want to sort of underscore the chatbot actually. That's a really new piece of innovation that we've just done. And it doesn't only guide a patient through their referral experience, it also uses an AI model to categorize and triage them. And it passes all that information directly into Salesforce using the APIs. So the therapist gets access to that information straight away. And I'll talk about the benefits of that later. Also, we've expanded the channels where service users can engage with us while they're in therapy, not just their referral. So for that, we use email, text, and phone. And I'll talk a little bit more about that later as well. And we've also importantly reformed our treatment options with a focus on more digitized and volume treatments, because at the end of the day, you know, a one-to-one treatment with a practitioner is really resource intensive. And some people don't need that to get better. So what we've done for that is integrated with several established digital therapy platforms, supported and unsupported, and we've allowed for bi-directional transfers of that service user information to make sure that the patient gets referred and their information comes back seamlessly. And also implementation of functionality to allow volume treatments to be conducted effectively. And more recently, that's been the use of webinars. So like the one we're on now, except I'll be delivering therapy, not IT.
Wow. There's a huge amount in there, Brodie. This is well and truly a transformation project. So what I'm hearing is that you actually thought about the efficiency side of things, almost, you know, in one group, and then you thought about the experiences of the service users in the other, and you approached it from that perspective, which makes total sense. But as they say, the proof is in the pudding. So, you know, what would be great to hear, and I'm sure our audience would love to hear, is what type of results are you seeing from the digitizing of your services, and how that has helped to improve that holistic experience for your service users?
Yeah, so it's been a real success story actually, but it hasn't all happened at once. We didn't get all these results at once, but I'll go through them anyway. So a more user-friendly and engaging process, and especially at our front door. So again, I'm going to talk about the benefits of that chatbot, which is really exciting. So we've actually seen a 33% increase in our IAP referrals by implementing that chatbot. And that guides users through the referral process, allows them to go through a digital triage process if they like, and that goes through an AI model, opens them a record in Salesforce, and books them their initial appointment with one of our therapists, and that all happens in under 10 minutes for them. And then all that information goes through the Salesforce APIs through into our application, And that wouldn't have been fathomable with any of the off-the-shelf applications that are out there. It just wouldn't have been possible. Salesforce Open APIs are really a game changer when it came to that. Also, we've improved our engagement with service users. So we've introduced standardized, templated, and automated SMS and email communications. And we've also reformed our contact center with Vonage and Salesforce's CTI. And that's translated into higher appointment attendance rates. So we've gone from, I think, a 15% DNA rate down to a 5% DNA rate. So that's really positive. And we've also had a lot of admin eliminated from people's appointments, which has increased the quality time you get with a practitioner, but it's also simultaneously reduced the appointment's duration, which means that obviously we can offer more appointments on a practitioner's diary, which is great. And it's also obviously translated into efficiencies. We've got better access rates, which is a key KPI that many commissioners look out for. I just said 33% increase in referral numbers just from putting that chatbot on our website. Great stuff. Higher appointment attendance rates, that's great as well, because it means we've got effectively that 10% extra capacity pretty much overnight from when we put that extra engagement in, especially appointment reminders through text. We found that really effective for getting the DNA rates down. Lower waiting times as well. All this has meant lower waiting times. And we can actually, if you come through our, what we call the golden route, if you come through our chatbot, which will triage your case, and you get a shorter assessment as a result of that, you can pretty much instantly go into one of our digital or volume treatments with no wait. And that's for service users, obviously, with less severe cases. But what that does is it frees up capacity elsewhere in the system, which is lowering waiting times across the board. And again, all this is obviously going to translate into higher service user experience. And we can see that through our PEQs in the focus groups that we have with our patients and our service users.
So impressive, Brodie. So impressive. Great numbers. I mean, of course, you want people to be able to sort of help themselves when that's appropriate. And then you obviously want to be able to get to people who need your help more quickly. So, I mean, this is great. Thank you for sharing. I mean, it's hard for me to imagine that you're going to have any answer to the next question because you've done so much. But what I want to ask you is, are there next steps planned? I mean, is there something else that you're planning? Are you scaling up delivery, or are you done?
We're never done. So we're in year 2 of a 3-year organizational strategy, and that's putting a renewed focus on transformation and an emphasis on digital innovation as well. And because of that, we're again investing quite heavily in scaling up our Salesforce and indeed non-Salesforce applications across the board. So we're putting a heavier focus on reforming digital processes to become more service user centric. And that's a term that everyone's throwing around at the moment. We want to make sure that from a service user point of view, the service runs the most efficiently in the best way it possibly can. Now, in the past, I think it's fair to say more emphasis was put on efficiency, which does translate into better outcomes for patients, obviously. But what we really want to do this time is really drive the engagement further. So we envision this will include further digital engagement channels, including two-way SMS and WhatsApp, Messenger, that sort of thing, introducing live chat and further enhancements to our telephony system with Service Cloud Voice. Also introducing a service user portal, maybe in the form of a mobile application. The jury's out on that one, where service users can log in, interact with their data, and also individually curated self-care materials, self-help materials for them, and recommendations for their care, as well as carry out the generic functions such as appointment management. And that really fills the gap in between people's therapy appointments, and that's what we see that doing. And you have put in here, in a world where it's as simple as 3 taps to book a barber's appointment, or get some delivered to your door, it should really be that simple to manage your mental health care as well. You shouldn't have to phone up for everything. It should just be all at your fingertips.
How true. Yeah, great point.
Yeah. Also interoperability. So that's a huge thing at the minute. I'm sure most people will be aware that the NHS is undergoing big changes. We're going from the CCG model to the ICP model, unless they've changed the name in the last 5 minutes of that again. Where focus is being put on organisations working together in an integrated way instead of siloed off. And as we, as an organisation, integrate with other organisations our people integrate, we're also going to need our systems and our data to follow suit. And yeah, my slide's gone again, sorry about that. We strongly believe in the principle that there's no wrong way to ask for help. So, a patient should be able to go to any relevant service and be able to be signposted effectively to the right service for them. And in a truly digitally integrated partnership, easy for me to say, electronically transferring care between providers should be, from one to another, should be seamless. And patients shouldn't really notice their transfer. They should just go from one place to another, the most effective place for them to get the help that they need. They shouldn't be bouncing around the system, which is what happens under the current model. You refer to one service, they say, well, you're not appropriate for us, you should try them. Then they go to a different one and they end up in a bit of a holding pattern until they can find the right service for them. So under the ICP model, we're hoping that this is going to change. And that's going to be driven by integration and interoperability. So to power that, we've invested in MuleSoft, which is a Salesforce product, which I think most people will be aware of, a lot of people will be aware of. And we're hoping over the coming year, we can leverage that to quickly and affordably integrate with other health and social care systems, as and when we integrate with these partnerships. And also, finally, we're also looking to drive further efficiencies. There's always room for efficiencies, automate more processes where we can, and utilize technology really to free our staff up as much as we possibly can, because capacity is a problem. And like you said, capacity is not going up, but demand is. So we need to find these efficiencies where we can. So yeah.
Makes total sense. Yeah, makes total sense. Thank you. That's great. So I'm going to ask one quick question, and because I know this is a question that I'd love to hear you answer if I were in the audience. What would you say were your key learnings from your journey thus far? Like if you had to make a couple of recommendations to people who are listening in today, who maybe are thinking about what can we do? How can we drive greater efficiency? How can we improve that service user experience? Give us your best.
Okay. If I had to give you one, it would be if there's a compelling out-the-box solution available, and you can make your use case and your budget work with it, you should seriously consider that. Now, that's not a strategy that we took initially. We went down the platform and heavy customization route. And at one point, we actually had over 300,000 lines of code in one of our Salesforce orgs. A couple of reasons for that. One was, back when we did make our first steps into Salesforce, there wasn't as much available as there is now. The second is that we wanted to keep our license costs down, basically. But, that can sometimes be a false economy, because what you end up doing is you end up building technical debt over time. And it means that you're using more and more resources to maintain what you've got rather than innovating. And actually, what we're now doing is completely reversing that decision. So we're going the other way. We're moving everything across to Salesforce products where we can. So we're going to start using case management out the box for Salesforce and community and sales clouds, and that's already underway. So yeah, we're trying to utilize the wealth of Salesforce features rather than try and reinvent the wheel ourselves. I think if I've got to give one thing, that would be it.
That's amazing, Brodie. Thank you so much, and thank you for sharing so many insights with us today. Hopefully, everybody found that as interesting as I did. And now I'm going to pass over to my colleague, Amy, and Amy is going to bring to life that digital service delivery lifecycle. So over to you, Amy.
Thanks, Susan, and thank you, Brodie. Wow, I was very impressed with that, and especially that example of 3 clicks of a button to order food. I think that's where we're trying to get to. So what I wanted to talk to everyone today about is bringing this example, really showing you an example of how an organization can provide us service user-centric experience to their service users. So I'm showing you an example today, and it's an example for an organization called Steps. So it's a fictitious organization, and they provide mental health support. But the same can be true for other types of social services organizations. If you're looking at like addiction support or family support, they can provide a similar experience. So for the demo today, we're going to look at two personas. One is a therapist called Simone, and another is a service user called Lauren. So Simone really wants to maximize the time she can spend with clients because she wants to create a positive impact on people's lives. And Lauren has been suffering with anxiety, so she wants to be able to engage with Steps and receive their services. So really, we're going to be looking at multiple touch points and how our service users can use these different digital channels in order to engage with Steps. We'll be looking at the triage, some person-centric support, deeper digital engagements, including SMS and live chat, and how our service users can self-service using an experience portal. So the key things we're going to touch on today is firstly how they can view us using social media. They'll be able to get in touch with us, fill out a web form for their referral, go through a triage process where they'll be intaken into an adult counselling program. Then whilst they're on the wait list, allow them to access our self-help support and allow them to engage digitally using Live Agent. When the waitlist opens up and they're accepted onto the program, they'll be able to schedule their own appointment, be reminded of that, and we'll then move perspectives to Simone. And Simone, the therapist, will get a quick overview of Lauren, view the history of notes that have been made about her, fill out an assessment to say how she's improved over time in her anxiety and depression. And lastly, she'll also be able to create a care plan to help Lauren meet her mental health goals and take actions to achieve those. And once she's completed this, she'll get a survey to see how satisfied she was with her therapy course. And we will continue to engage with her afterwards, because it may maybe not be that she's completely fine forever, but she may want to come back to us, and we want to help nurture that relationship with Lauren going forwards. So to get started, we can use marketing automation to actually post out social media posts. So for example, Steps has posted on Twitter here, asking if anyone wants to receive support from them and sending them a link to their self-refer area. This allows us to send social posts out and track the traction that Steps are getting on this channel. And if it's getting a lot of traction, they'll be able to see what channels are providing the most traction for them. This isn't the only channel. We can also have emails, and also you might have a referral portal for other organizations to refer people into your services. So Lauren's going to click on that link, and she's going to be taken to a referral page. This is using web to referral functionality, which allows us to automatically create that referral. It's basically spinning up some HTML text to us, so this can be completely customized and integrated into your website using your CSS and HTML. So she's going to submit this referral with her phone, her email, and a subject and description. And it's going to go immediately into Salesforce. So here is that referral. So she's anxious and she hasn't left the house much recently. And here we are logged in to our Steps organization's Salesforce. Here we can see all of the queries and referrals that have come in on any channel. So here we can see there's some from SMS, some from the web, and some from live chat. This means that our management can just be in one place and receive all of the referrals where they are. Clicking into that referral, referrals to click into, but we'll click into the referral here, and here we can see some information. So we can see that automatically when she created this referral, we sent her an email to say, thank you for connecting with us. We're taking a look at your referral and it's been logged. So this means that when she creates a referral, she has that kind of peace of mind that it has been received and she knows this. We can also see some milestones on the right-hand side. So we want to respond within an hour. We want to start intaking her within 2 hours. So we can have different milestones for reaching out to Lauren and making sure that we're intaking her in a timely manner so that she gets that seamless experience. We're going to link this referral to an intake, and this intake allows us to capture a series of information that will help us determine whether or not she's appropriate. You can completely customize what you're going to be collecting here. It could be DEI information or some personal information. So we still have to collect her emergency contact details. And we can see how far we are along with completing each action when it goes green. We can see that we're currently in process here, and we currently need to add that emergency contact details. So Doug is her father. And so we can capture that emergency contact details here. We can also contact other collect other information such as GP referral letters, a pre-therapy assessment to see how she's doing, and other information that we'd like to collect here. And we can also see where the intake source was. If she's inappropriate with our services, we can create an outbound referral to track where we are signposting her to. But if she is appropriate, we're going to approve her for the adult counselling session and create a new program engagement. Here we'll put her in the adult counselling program as a client at the waitlisted stage. Because currently our adult therapy is full. So we can now manage our wait list, and we'll let Lauren know that she's on the wait list and ask her if she wants to engage in our community in order to support her in the time that she's actually waiting for services. So we'll go on to Lauren's contact record. Here we can see that she's currently waitlisted for the adult counselling program, and we can send an email from directly within the STEPS Salesforce in order to let her know that she's been waitlisted for the adult counselling therapy. And we'll let her know, why don't you engage on our Experience Cloud portal so that you can start to get self-help support whilst you wait. And we can send this over to Lauren. So Lauren is going to click on the link in the email, and she's going to be taken to our portal. On our portal here, Lauren can actually engage with STEPS directly. This portal takes Salesforce data, Salesforce business processes, and most important, Salesforce's security. So you're only sharing with them exactly what they want to see. We can provide articles here, for example, 5 steps to mental well-being, and we can see whether or not she engages with this and whether or not she finds this helpful. We can provide multimedia engagement as well, such as videos, which she can play directly within the Experience Cloud in order to see, for example, a video on mental health support. And lastly, she can engage in different topics. Here she can have forum engagement with other clients and service users in a secure and moderated environment. You can have different topics such as substance abuse, housing support, or family support here. Whilst she's waiting, Lauren's getting more anxious and she wants to get in touch with someone from STEPS. So what I'm going to do is I'm going to show you how she can engage with STEPS using the portal. So here I am, logged in as Lauren, but instead of my phone on the right-hand side. So our Experience portal can be used on the mobile device, or it can also be used on the desktop. And here we have the agent on the right-hand side here, which will show you how they can respond to Lauren's query. So here we're going to set Lauren as active, our agent as active, so that they can receive support requests. And we're going to just refresh this so that we've got our active agent. So we're going to chat with an expert here. We're going to say, you know, we need support. And we'll start chatting. Now, this is a point where you can put in a bot as well in order to capture some information, such as if it's age, you might only want to route them to someone who can has the skills to talk to someone who's maybe under 18, for example. So you can also provide routing in here. When our agent accepts this chat, it's actually going to deduplicate against Lauren's contact record and going to bring up all the information about Lauren that we have so far. And it allows the agent to respond to Lauren here. So we're going to say, thank you for contacting us, Lauren. And on my phone, Lauren can say, hey, it's on my phone here. I am feeling sad. So, and then you can maybe engage in an actual therapy session through live chat whilst Lauren's waiting for her in-person counselling session. So during this session as well, our agents can actually use knowledge here in order to suggest appropriate knowledge articles. For example, a knowledge article on how to respond to this person who's letting you know that they're currently feeling sad. And these can also be shared with your service users on the Experience Cloud portal. So Lauren can engage with this live chat, but she can also engage with in-person sessions as well. So going back onto my homepage here, once she's approved for our adult counselling therapy, she can actually schedule her own appointment using the book appointment functionality. So here she's going to be asked what kind of support she wants. She could be given multiple options, such as relationship counselling or CBT therapy. We can collect extra layers of information, such as she's currently struggling with anxiety, so that our advisors are able to adequately respond to her. We can provide Zoom or in-person therapy. So the Zoom, the virtual can integrate with Zoom in order for you to be able to provide that Zoom therapy. But for now, we're going to be doing it in person in London. And now it's going to show everywhere that we provide therapy in London, such as our London Therapy Centre. She can have a look at all the people that have the skills to work with her, and she currently wants to work with Connie. And she can see that Connie has got availability on Friday at 2:45. And this is now looking at Connie's availability on her calendar. So we're going to select that time slot and save it. Connie is now going to have that appointment in her calendar. I'll just go to into her calendar. Here's the calendar. And here she can see any therapy sessions that have been booked with her. So that one at 2:45 tomorrow has been immediately booked. And she has a couple of other therapy sessions in London. Going into that session, Simone is able to see like a full history of Lauren. So here she can see that she's enrolled in that adult counselling program. We can see across the top there some information about Lauren, such as client alerts. She's got a severe peanut allergy. You can add in any custom client alerts here based on Lauren. We can see a full history of all of the notes that we've had about Lauren. So that, for example, in our supervisor meeting, we can go over how Lauren is doing with our supervisor. We can also create assessments. So between now and last month, how has Lauren been doing? Here we can see how she's been doing over time. And we can create a new assessment. And as she's in this therapy session with us, in order to say, this is going to be her kind of post therapy assessment. Here we go, and we're going to complete that today. We'll give her a total score of 10. bipolar anxiety and depression. So you can really decide what you want to capture here. You can also build on this. For example, is there risk if I tick it? I'm going to be showing a list here. If there's high risk, we're going to want some comments here on what exactly it is. And we can save this. So it can be qualitative and quantitative information you're capturing. And when I save this, we're going to have that new really high score coming up on her assessments. So she's doing great now. So what we've seen so far is how she can use those self-help articles. She can use live chat. She can schedule her own appointment. And Simone has been able to get a 360-degree overview of her, view her notes, and log an assessment. Next, we're going to look at how we can create a care plan for Lauren to make sure we're helping her achieve her goals and actions going forward. And we're going to also send a post-therapy survey and follow-up journey. So on the case plans here, we can actually, I've got one already open, create custom case plans for our clients. These can use templated goals and actions, or you can also create completely custom ones because you want to be service user centric and make sure you're capturing exactly what your clients need. So here we can see that we haven't started this goal, which is to take part in exposure scenario, but we have actually completed including activity into our routine. And we can share this all with Connie on her Experience Cloud portal. So after she's engaged with us and completed her course of therapy, we can send her an email in order to ask her to give us feedback on how she thought our therapy was. So what we will do here is I will show you how I'm logged in again on my phone in order for Lauren to complete her survey feedback. Here she can let us know how she thought it was. She thought it was great, how she was feeling before and how she's feeling now. And you can basically create custom questions and answers in order to capture feedback from what your clients thought of your therapy sessions. And this will all be captured in Salesforce survey. So when I refresh this, we're going to see that new response come in. So that's the person that started it. And we can see how all of our clients are doing overall and how people have thought our therapy was. After they've completely finished therapy with us, we can also put them on a nurture journey. For example, we might send an email, say, how did you find, it's been a week, how are you still feeling? Why don't you engage in our community forum with other service users to support you? And depending on whether or not she opens this email, we can send her a reminder email because everyone gets distracted, letting her know that she can engage with the therapists and continue to engage using live support through our Experience Cloud portal. Now, the last thing I did say I would show you as well was just the SMS piece of it. So, once the session has gone, the case has gone from new into working, we can also send a reminder text message here. So I'm going to actually save this now as working. So we're working on that case and we're going to see an automatic text message coming through that's saying, hi, Lauren, we're currently working on your referral and we're going to be in touch soon. So yeah, you can really use all those different digital channels in order to engage with your clients and provide them a kind of digital experience. So I'm going to hand back to Alice to do Q&A.
Hi, thank you for that, Amy. That's so interesting, especially for me as I'm head of customer service at Charity Digital. So yeah, super interesting to see how it can be used. So I'm just going to move over to the questions. I know we've got some in the chat and some in the Q&A. So if I go to Kat has asked, I think this was to you, Brodie. This is super interesting way of referrals being triaged and then onto appointments. However, we have up to 100 practitioners. So our challenge as a charity is the cost of Salesforce as a license for each of those 100 Salesforce users. How did you balance that cost as a return on investment? You are on mute.
That's embarrassing. There's tangible and intangible sort of decision-making parameters that we use. So to start off with, every solution that you're going to look at is going to have a cost associated to it. So, we talked about before, we used to use industry-specific medical systems, and they are generally quite expensive. So we were able to quite easily justify the cost based on, how much Salesforce costs in conjunction with that, but also, the reduction in, the increased productivity and the increased resources. If you look at that as a balance of practitioner time, we have to pay the practitioners for the time that they work. If you say, you save them 10% of their time using this application, then essentially, you've made a 10% saving there, which you can offset against it. So there was a lot of different factors that went into the decision, and it wasn't all financial. I'll not go into it, but it wasn't all financial. There's also obviously the service user experience piece, which is also very important, and that's how we made our decision. So yeah.
Excellent. Thank you, Brodie. There's another one as well for you. In terms of formulating your service user experience, did you do any research into how digitally equipped your users were? It's a really good question. One of our projects is a women's homeless project. So by the very nature of the users, digital poverty is a massive issue. It's a big consideration how we can embrace digital delivery whilst recognizing service user barriers to access. Any thoughts?
Yeah, it's something, it was certainly a consideration, but I think, the starting point that we were at, we didn't take anything away from patients. We've still got the traditional methods of referral. You can absolutely still call our contact center. You can absolutely still walk through the door. We just added more on top of that. And I think the part where that can become a little bit tricky is when you're obviously using digital to save time. So, specifically that, I'll go back to the chatbot. If someone goes through that chatbot, then we need to give them a different type of assessment. Their assessment can be shorter because the chatbot's already collected a lot of the information that we need to collect. And it's about, and then they can move through a therapy quicker, which can often, or it can, if you don't manage it properly, mean that some people maybe jump in the queue, if you like. They're getting through into treatment faster than someone who referred before them. So there's a balancing act. But of course, it's efficiencies that we're making that are they're gonna bring the waiting times down for everyone. So it's a good question. It's a balancing act. But what I'd say is, it's gotten better overall. We haven't taken anything away from patients. We're increasing efficiencies, which are going to benefit everyone.
We've got another. So I work with low capacity organisations that are looking to digitise processes and service delivery. However, budget and resource are barriers. Can you give any tips on getting started with Salesforce and calculating costs?
Yeah, it's low capacity organisations. I don't know what you mean by that. Maybe only a few practitioners or something like that. But I think I'll go back to what I said as my one piece of advice. It can look more attractive to go with cheaper options, such as building on top of the platform. And that can work for a lot of people. And it is what a lot of charitable organizations did, like quite a lot of charities like us when we started up our journey. But I would carefully look at what you see as your return on investment. So, if you're increasing what those therapists can do in the amount of time that they've got, that's something tangible that you can put against your investment on Salesforce. And also look at, Salesforce development isn't cheap. So kind of I think you need to balance all these things. I can't calculate your specific costs, I'm afraid. It would very much depend. But yeah, reach out to Salesforce. I think they've got good pre-sales team, and they'll be able to help you with that.
Excellent. I think we've got time for one more, which is, what ROI measures did you use for that investment?
Yeah, so again, about we mainly used efficiency for a tangible, something tangible to put against investment. We've made ourselves more efficient, therefore we've got more time to spend with practitioners. You know, you can effectively put 10% of a practitioner's salary. I'm saying 10% as an arbitrary number, but say that we save 10% in efficiency. You know, you can put that 10% against the costs for it, you know, 10% of that practitioner's salary. That's one way of doing it. Also, there's the intangibles, isn't there? There's the increased engagement. You know, a lot of the different financial models of different services are all very different. You know, some people get payments based on engagement and based on retention, based on access, you know, and if a digital solution increases those, then you can get extra payments from that. It's a tricky question to answer because it's very specific per.
Very dependent, isn't it? Yeah.
But for us, it was mainly around, you know, offsetting the efficiencies against the cost, and more often than not, we actually save money by making those efficiencies even after we've paid for the additional licensing.
Excellent. I don't think there are any more questions. Just have one last look. No, I don't think so. So unfortunately, we have run out of time. We will be collating all of the recordings, the slides, and supporting resources. So please keep an eye out on your email inbox. And I just want to say a really big thank you to all of you that has taken the time to attend the webinar on digital service delivery. We hope it's been insightful and inspiring, and you can find more of our charity digital webinars on our website. We've got some great sessions coming up, so stay hydrated. I hope you get some warmth in Ireland, and have a wonderful afternoon. Take care, guys.